All new this morning, 41 Action News reporter Dan Cohen introduces us to a small but mighty team doing their part to improve accessibility.
Dr. Allison Edwards first identified a COVID-19 testing problem and solution when the pandemic began.
We decided to get together and try and solve the problem through a more of a public health community-based effort.
She got together with Jay Austin, a decarceration activist in Kansas City.
I started thinking about why this would matter for the population that I tend to work with when I work on criminal justice reform.
And then they got together with Heart to Heart International.
Have you been called before?
The result? COVID-19 testing to underserved communities.
As of November, we had completed over 5,000 tests at no charge to community members. And we've served various locations across the metro, both sides of the state line, both within Kansas City, into the suburbs, and into the outlying communities.
Dieter Aguilar is seeing it firsthand as pastor at La Fe, Kansas City.
I think it's very critical. Many of our people within our community do not have insurance. They live, paycheck to paycheck because they don't have insurance.
They've made progress, like this testing site at Kansas City North Community Center, but they say there's more work to do.
It's been difficult, to say the least. It's a supply-demand issue.
And they're ready for the next frontier in the pandemic.
Our ambition would be to partner with the local health department, with the states, to be able to get vaccines into those areas so we can see vaccine rates increase all over the metro.
This team wants to continue the public health nonprofit effort for these communities.
With Latinos dealing with them, they don't always are open to go to hospitals because of things that they've heard. But they're a little bit more safer, feel more comfortable coming to maybe a church or a community where other people have gone.
And they say their work will continue after the pandemic has passed.
My entire mission in being a physician is to make sure that we call out the inequities in the healthcare system. And so that is my ambition long term, is to always stand up and say, this is where there's gaps, these are where there are holes.
Reporting in Kansas City, Dan Cohen, 41 Action News. Dr. Edwards and her team have been working around the clock since the pandemic began in March. As we said, Heart to Heart International is helping with this initiative, as well as KC Parks. They've both helped with that testing site at the Kansas City North Community Center. Taylor and Lindsay, back to you.
So, Dan, you mentioned the vaccination phase of the pandemic. How is Dr. Edwards navigating that with her patients and those that are benefiting from the free testing right now?
Yeah, Taylor, Dr. Edwards calls it vaccine hesitancy right now. The clinic that she runs in KCK, she says that she's trying to alleviate fears, hear out concerns from patients and those that are benefiting from this testing. And that's one of the biggest things she's running up against right now is, again, calming folks down and letting them know that these vaccines are safe. We've covered how availability is a problem in our area, as well as reluctance to take a vaccine too. But this team is pushing ahead, making testing available and focusing on helping out with vaccines when those become available in the future.
All right, Dan, live for us this morning. Thank you very much.